Hi, I'm Dr. Julie Steinauer. Well, I bet you never guessed you would see me in a video looking like this. So let's take that thing off. Whew! I know you do that. Every time you walk out of the store, you just rip that off to be able to breathe. Let's talk about the things that can come up as a result of wearing these masks, because there's actually one associated with vision that all parents need to know about, and even, just adults need to know about. So not only do you have to be concerned about the possibility of headaches, brain fog, issues with, cognition, even like memory being affected from lack of oxygen and wearing the mask for yourself or your kids, you also want to be thinking about, like, is that breakout around their face maybe a staph infection? Boy, go look those up. They're all over the internet of kids and adults who are having breakouts of staph because of a wet, moist environment being covered here all the time at school particularly, but for those who are having to maybe do it for their jobs. But here's another one. As if you didn't have enough to be thinking about or being concerned about, we do notice a lot of kids coming into our clinic, particularly children, coming into our clinic who've developed binocular vision problems. So you might be looking at your child after a long day of school, whether they're hybrid, whether they're in the classroom, 5 days a week, but however long, they're probably wearing a mask. And what happens is, if I put this on, let's just show you. First of all, it fogs up my glasses, so that right there is a no-win for me. But if I put this on and I look down, I can see my mask. Well, what's occurring for a lot of patients who come into our clinic is they're developing binocular vision problems, where we might actually see them developing a strabismus or an eye turn. Because this is in their line of sight, they can be drawn to it, which could cause them to develop an esotropia, which is an eye turn in, or they could be so annoyed that they're allowing their eyes to rest out, and they may develop an exotropia or an outward eye turn. Kind of depends on your child's personality as to which one of those could occur, and multiple other factors, but either one of those types of strabismus could actually develop as a result of wearing a mask. So as though you didn't have other things to be worried about or concerned about, now we need you to start thinking about, is my child's binocular vision a result of wearing a mask? Their problems? Possibly. Now, we see it even with patients who've been in our vision therapy clinic who are back in school now, and they're in hybrid situations, or maybe they're in school 5 days a week. And so if we're seeing it, I know it's out there in the world too, and other people are going through the same thing. So be watching your kids, be paying attention. Are they suddenly, maybe they were a great child, great student in the classroom, and now all of a sudden they're losing their place with reading. Now they're more distracted. Now they're not paying attention nearly as much. Now they're forgetful. Now they're forgetting things. Now they're, maybe not performing as well on tests or on homework. These are all kinds of things that you want to be looking for. Maybe their reading is affected. And if that's the case and you notice these things, then pay attention. Do you ever notice anything different with the alignment of their eyes? Does an eye seem to wander? Or wander this way and cross in? If you notice those sorts of things and you've never noticed them before, then you definitely want to have that checked out. Now, if you're local to us, give us a call at 618-288-1489. If you're not local and you happen to be in another state or even another part of the world, then you can go to our website and fill out our questionnaire. We actually do have patients from all over the world that we work with, and we're super blessed to be able to do that. So we could potentially work with you and help your child as well. Thank you.